student at Duke and research assistant at the Center for Child and Family Policy. Before introducing our guests, I have a few words about logistics. First, our panelists will present for about 8 minutes each, after which we will have a short discussion and then open up to discussion for the remainder of our time. You may submit questions via the hop-in chat function at any time during the presentation. Thanks. And welcome to our panel presentation on Putting the Pieces Together, Lessons from Legislative and Ballot Wins for the Universal Approach. As Patricia Cole highlighted, we are at a moment of inflection as a country in terms of how federal policy will or will not rise to address the universal needs of families with young children. Also true is that policy change in support of the universal approach is already happening at the local and state level. Our states are truly the policy labs for innovation in early childhood policy. And today we will hear from 3 panelists about what some of these policies are and what it took to get them into law. We are pleased to welcome our 3 panelists. First, we have Senator Elizabeth Steiner Hayward. Senator Steiner Hayward is a Democratic member of the Oregon Senate representing the 17th District. A family medicine physician by training, Senator Steiner Hayward has championed legislation to improve Oregon's health system, including establishing the state's Coordinated Care Organizations, or CCO system, and the nation's first statewide universally offered nurse home visiting program, which she will share more about. Senator Steiner Hayward is an adjunct associate professor of family medicine at Oregon Health and Science University, and she is also a past president of the Oregon Academy of Family Physicians. Next, we have Caitlin Altoon. Ms. Altoon is an organizer at 9 to 5 Colorado, a chapter of one of the largest and most respected national membership organizations of working women in the United States. As part of her work at 9 to 5, Ms. Altoon organized for the successful passage of paid family and medical leave in Colorado through a 2020 ballot initiative. And prior to successes at 9 to 5, Ms. Altoon has directed canvassing teams in fundraising for progressive nonprofits and served as a mental health worker for children with trauma stemming from abuse. And we are also joined by Dr. Christian Bell Anyamali. Dr. Bell Anyamali is the first director of evaluation and learning at 4.0, a Texas nonprofit seeking to remove barriers between people and power by centering, nurturing, and supporting human-centered ideas in education. She is responsible for measuring the efficacy of 4.0 programs, empowering their fellows to measure and evaluate efficacy and demand for their programs, and establishing 4.0 as a thought leader for their unique education research and development model. In addition to her work at 4.0, Dr. Bell Anyamali is also CEO of her own consulting firm, where she helps educational and youth-centered nonprofit leaders effectively demonstrate impact and secure more support using clear data.
With you. Hi, I'm Elizabeth Steiner Hayward, and I am looking forward to talking with you about the work that we've done in Oregon to pass a measure that will implement a statewide universally offered home visiting program. Next slide, please. So why did we decide this was important? Many of you know that there are a range of evidence-based home visiting programs that have been in use and are McVie certified for many, many, many years. And they have done extraordinarily good work. Organizations like Healthy Families, like Nurse Family Partnership, and I could go on. However, most of these programs have a very limited target audience, and that audience does not allow, and the programs themselves are so intensive that does not allow them to be offered to a wide range of people. That being said, anybody who's ever brought home a new baby, and I've had 2 of them, knows that every baby creates new family dynamics, brings new challenges to a family, and makes things different and brings new opportunities for growth, but also new places where families could use support. So with that in mind, we started to think about what opportunities we had to create a new model or implement a new model. Next slide, please. Early in 2018, I had the opportunity to attend a conference run by the Casey Family Foundation to talk about child welfare and how do we do a better job of preventing kids from ending up in the child welfare system and then taking care of them if they do end up there. One of the things I learned about there was the Family Connects international model of home visiting. And what this is a universally offered home visiting program, which is a very broad-based but low-intensity program. From 1 to 3 visits offered to every single family with a new baby. And this program was started out of the Duke Institute in North Carolina about 10 years, almost 10 years ago now. And it is evidence-based. It's been shown to reduce emergency department visits. It's been shown to reduce interactions with the child welfare system. And the point is that it recognizes that everybody has challenges when they bring home a new baby and may need connections. The program offers, for families that choose to have a visit, a standardized assessment over 12 domains by a trained public health nurse. And these include a physical assessment of the mother. How's she doing physically postpartum? A physical assessment of the baby. How's the baby doing? An evaluation of the home environment in a very non-judgmental, supportive way. A psychosocial evaluation. Is the mother struggling with postpartum depression or anxiety? Are there substance abuse issues in the home that the family could use some support to deal with? All those, is there food insecurity or housing insecurity? What kinds of needs does this family have that we could help them with so that they can thrive? Additionally, on top of a standardized assessment, every community that implements this has a community advisory board to ensure that the program meets the needs of that community. So things can be added on. Some communities, for example, choose to offer very early information about early literacy, pre-literacy, which is very important in communities with low literacy rates. Others offer other kinds of opportunities, whether that's lead testing for water or things like that. And then after the visit, based on a conversation with the family, the nurse connects families with necessary resources, whether that's parenting programs, and those could be government run ones, or nonprofits like relief nurseries, or faith-based ones. This is whatever's going to meet the needs of that family best. Next slide, please. So working from that model, I had been serving on the governor of Oregon has a strong interest in early childhood and had put together a children's cabinet on which I had been serving. And she asked me to chair a work group over the summer of 2018 to put together some plans for legislation in the 2019 session to think about how do we best address the needs of families with very, very young children, new babies, very young children. To that end, we pulled together a stakeholder group of other legislators, rural and urban, Democrats and Republicans, House and Senate, the hospitals, because hospitals have to be willing to have public health nurses come in to meet with families after they have a new baby, public health experts, other stakeholders, including commercial insurers, things like that. And we crafted a bill that met the needs of all of these different stakeholders, including, unlike other places where this had been implemented, a requirement that commercial insurers must pay for the cost of this program for commercially insured families. This is not a program just for families on Medicaid, although in Oregon, like in many states, about 50% of babies born are born through the Medicaid program because mothers are covered up to 300% of federal poverty level. And in other communities, the universal aspect has been covered by grants from commercial insurers or other entities. In Oregon, we wanted to be sure that this was sustainable, so we put in a payment requirement for insurers. Next slide, please. We passed that bill with very strong bipartisan support, Republican co-chief sponsors, Democrat chief sponsors, and it really went over very well. The one little glitch I would mention that's important is a linguistics one. We originally called it universal home visiting, and some people interpreted that as being mandatory. In fact, of course, it was an opportunity, so we changed it to what's called universally offered home visiting in Oregon to address some concerns that were raised. Now, of course, we had planned by now to be much further in implementation, but #COVID, something we've all been dealing with for 2 years now, has made it much more challenging to roll this out. Another place we've run into challenges is that, as most of you are aware, the Federal Employer Retirement and Insurance Security Act does not allow states to mandate coverage of certain items for employers, people who are covered by employers that self-insure, or RISA. That being said, most of those programs are administered by commercial insurers under a third-party administrator agreement, and most of the time, those third-party administrators automatically include coverage for things like university offered home visiting. And in fact, that's been the case with a few exceptions. The biggest challenge has been that although we thought we were clear in the legislation that commercial insurers had to actually pay the costs, what they were willing to offer was dramatically lower. So we had to do a little technical fix bill in the 2022 session, but we got that through with strong support. I'm excited about this program. I think it's an extraordinary opportunity, and I look forward to talking with any of you about questions and talking with my fellow panelists. Thank you so much.
Hi, everyone. Thanks so much for having me today. My name is Caitlin Altoon. I'm an organizer with 9 to 5 Colorado, and I'm the current chair of Colorado's Paid Leave Coalition. And today I'll be sharing with you the story of passing paid family and medical leave in Colorado. Next slide. So what paid family and medical leave is when workers are able to take paid job protected time off from work when they have a serious health condition themselves, they have a loved one with a serious health condition that they need to care for, or because they are welcoming a new child, whether that is through birth, foster, or adoption. So Colorado, we passed paid leave at the ballot in 2020, and it will go into effect in 2024. So over 80% of US workers currently do not have access to paid leave. And this is forcing some really impossible decisions between folks' health, their family, and needed paychecks. This problem disproportionately impacts women, especially women of color, who are more likely to be caregivers as well as paid lower wages. So equity and keeping impacted folks front and center in the fight for paid leave is really essential because it's the expertise of lived experience that's the key ingredient for crafting equitable policy and also building the power needed to make it happen. Next slide. But not all paid family and medical leave programs are created equally, and as a result can leave folks behind who really need the program most. In Colorado, we held to the policy pillars of affordable, adequate, and accessible to ensure we were passing a program that really was equitable. Affordable programs have workers and employers contribute proportionately to their pay, and has the state run the programs. It is adequate if the amount of time workers can take leave is long enough so that they can really benefit from that leave. For Colorado, we passed 12 weeks, which I think is really the baseline. Adequate also means that workers, especially the lowest paid workers, are paid enough while they're on leave so that they can actually take that time that they need off of work and that their jobs are protected. To be accessible, it must include all types of workers, allow workers to care for family members, no matter how they define family, and that leave is portable, meaning it's not attached to your employer. You can think of how health insurance typically is. And throughout the campaign, especially when decision makers attempted to make us compromise, impacted community members' stories really painted the picture of why these pillars are essential and what those real life impacts look like. Next slide. So despite paid leave being widely available in the rest of the world and its clear benefits, paid leave policies have not had the easiest path in the United States. We worked to pass paid leave in Colorado through our state legislature for years. And it wasn't until 2019 that we really saw that we had a clear path to winning. But it ended up being that year we were the #1 lobbied against bill. And I think that really says something. So the following year, we ended up facing a brand new challenge. This was the 2020 legislative session. We faced the issue of privatization. So this was instead of the state-run program, which we had been championing this whole time, we were being asked to compromise and have a private version of paid leave that would have been run by insurance companies. This version, it had never been on the table before and was a direct contradiction to our affordable, adequate, and accessible pillars. So we had to really organize and work as a coalition, and we were able to defeat this privatization attempt. But this was really hard because we did have a lot of folks who, wanted at least something. But it was really by showing how the most marginalized communities would be left behind because of how for-profit companies operate, that we were able to change the course. So we did defeat it, but at this point, we needed to turn away from the legislature because we did not have a clear path forward there. And we ended up, still in 2020, going to the ballot, and we won. We're the first state to pass paid leave at the ballot, and it was such a huge win, and I think it's really meaningful that it was achieved by the voters. Next slide. So I want to expand just a little briefly on why we fought so hard against privatization of paid leave. For-profit companies, they exist to make a profit. And when that is your priority, then the people who are most vulnerable will be harmed. And that's because corners get cut, there's a lack of transparency, and the state can get locked into depending on these companies, even when they know it's going badly. But when states operate paid leave, their main priority is providing paid leave to all qualifying workers, which is how it should be. Next slide. So yeah, it is really my hope that we continue to see paid family and medical leave programs grow, and as more states work to pass their own paid leave programs, it really just can't be done without centering community. Impacted folks have to be at the table in order to create policies that reflect the complexity of our experiences and don't perpetuate systems of oppression. Because we had a coalition that was really centered in values, each time we were asked to compromise, we were able to hold ourselves and others accountable. And even with data and successful examples on our side, being rooted in community is what got us through each challenge, because it was impacted folks telling their stories and taking action that really shifted the scale. Next slide. So yes, thank you so much. I definitely look forward to questions and discussion, and I really appreciate being able to share Colorado's journey. Thank you.
Hi, everyone. I'm super excited. First of all, I'm Dr. Christian Bell Onyemali, and I'm super excited to share with you about Oklahoma and it's a passage of universal pre-K. So for my presentation today, we're going to be going back in time. This is a review of my dissertation, which I published about 10 years ago. And then also Oklahoma passed pre-K legislation back in '98, so almost 25 years ago. So we can go to the next slide. So here's just a little bit of a background about Oklahoma and their pre-K, what happened with pre-K, universal pre-K legislation. So in 98, Oklahoma became the second state in the nation to offer universal pre-K to all children in the state. It's not income-based or anything like that. And so my dissertation was really looking to understand the why, like what sort of political processes led to the development of universal pre-K in a state that is socially and fiscally conservative. I'm also from Oklahoma. I was born and raised there. And so I also have just like a personal connection to this work and this story. So we're going to talk a little bit about the history of the development and then also identify some lessons for today. So if we can go to the next slide. So here is a quick overview of universal pre-K in Oklahoma. Like I said before, it began in 1998. It's in public school settings. So we have pre-K is like another grade at many of the public schools, but then also school districts subcontract with classroom providers. So we'll have pre-K in community-based programs and childcare centers, Head Start settings, and things like that. And we'll also have like these collaborative sites where children will be enrolled as public school enrollees, but they're also receiving the same services as children in public school settings. So they're at these sort of mixed sites. Something else to share about it that's not listed on the slide is the state also has comprehensive early learning standards. So it requires teachers to have a bachelor's degree. Class sizes are capped at 20 students and requires a 1-to-10 teacher-student ratio. And students also receive vision, hearing, health, and other support services, at least one meal a day. And the program is monitored via site visits. And this has been in place since 1998 as part of the requirements for pre-K in Oklahoma. And on the right, there's just some stats about how many children actually enroll in pre-K as of the 2019-2020 school year. And we see that there were over 42,000 children who were enrolled, and that represents 100% of the school districts participate in universal pre-K. And then also 70% of the state's 4-year-olds are enrolled in the program. So a pretty widely and comprehensive program where people are opting into it. Parents and families are opting into it for their children to attend, and school districts are as well. And then it also is high quality, given what I said earlier about some of the comprehensive learning standards, which made it meet 9 out of 10 of the National Institute for Early Education Research's quality standards. Next slide. Okay, so now let's get to the actual, how did this even become a law in Oklahoma that we would have universal pre-K, and it's free, it's part of the public school program. So there's this in House Bill 1657, which was passed in 1998, as I mentioned before. It has this line: children who are at least 4 years of age, but not more than 5 years of age, on or before September 1st, shall be entitled to attend either half-day or full-day early childhood programs in their district free of charge. So this is one sentence, quite a powerful sentence that made it into a bill in the 90s, late 90s. On the next couple of slides, I'll talk about how that came about and how we got to something that's so powerful. And just one simple sentence really has changed potentially changed the trajectory for thousands of children in the state of Oklahoma. Next slide. Okay, so like I said before, this is based upon my dissertation. So of course, I have some theories here to help understand and to explain what happened. So this is based upon Kingdom's streams theory from 1995. And so there's a problem stream, a policy stream, and a politics stream. And so I'll talk a little bit about each of those streams and how that came to play in Oklahoma's passage of universal pre-K. So we start with the problem stream. So the problem was in the early 90s, there was something in this, there was a law that allowed school districts to enroll 4-year-olds into kindergarten. And so what was happening was a lot of rural districts were taking advantage of that for the additional money that will bring into their districts. However, as you all know, 4-year-olds shouldn't be in kindergarten. Like, that's not really developmentally appropriate for them. They should be in something like pre-K, right? But that wasn't something that was available to parents because of costs and things like that. So this is a problem that was presented. A constituent in a city called Veneta, Oklahoma, which is a rural city in Oklahoma, came and brought this problem to a legislator, which we'll talk about on the next slide. So they brought, if you go back, yeah. So we'll talk about Joe Edens in a minute. But they brought this problem for 4-year-olds being enrolled in kindergarten. So then the policy was like, okay, well, let's just remove the option for districts to enroll 4-year-olds in kindergarten, and we're going to add full-day pre-K to the state funding formula. I know there's a lot in there. It's like those are two pretty massive things to add into from a policy perspective, but we'll talk a little bit more about how that came to be. And then we have a politics stream. So we have a well-read and understood, a junior legislator who understood the value of early childhood education, understood that 4-year-olds should not be in kindergarten. They should be in a classroom setting or a learning setting that's appropriate for them. And he was able to drum up support from his colleagues while also omitting a key detail, which is we're going to add full-day pre-K to the state's funding formula. So these three streams sort of came together to make it sort of a perfect storm of how Oklahoma was able to pass universal pre-K. So if we go to the next slide, we will talk about another aspect of Kingdon's theory, which is about a policy, what he calls a policy entrepreneur. And so in this case, the policy entrepreneur who really helped this, that junior legislator that I was talking about earlier, who made this happen, was Joe Edens. He was in the Oklahoma House of Reps from 1994 through 2006. I had the opportunity to interview him in depth for my dissertation to understand what happened, how he got here, and why. And so first, let me just sort of explain what a policy entrepreneur is. It's basically individuals who exploit opportunities to influence policy outcomes so that they promote their own goals without having the necessary resources to achieve this alone. So they're not satisfied with promoting their self-interest. They're looking for innovative ways to address problems that they see. And so that's what he did. He saw this problem. He understood that in order to make this happen, he was going to have to work within the legislature. He was going to have to use his knowledge of early childhood education to advance the goal, and simply wrote into that House bill that children will be entitled to full or half-day pre-K free of charge. And he kind of slipped it in there and no one knew about it. And he just talked about other aspects of the bill and no one paid attention to that, and the bill was passed. And so on the next slide, we'll talk about just some ways to how to, like, what lessons to learn from this. We can go to the next slide. So I just have like maybe 1 minute left. So I'll just really focus on the third one about identifying windows of opportunity to create your own perfect storms, as what happened in Oklahoma. If you talk to Joe Edens today, he'll say no one could ever pass this sort of thing today with universal pre-K. No one want to pay for it. It's too expensive and all these other things. And I don't want to be fatalistic in that way, but I will say it is challenging. So we have to think about ways that we can sort of exploit different opportunities to advance our goals, to be more innovative in the approaches that we're taking to make sure that our children have the best outcomes that they could have going into their futures. So that's all I have for today. I'm looking forward to any comments or questions. I think on the next slide, I have my, you can connect with me on LinkedIn if you have any questions, but definitely looking forward to talking with the other presenters.
Senator Steiner Hayward, Ms. Altoon, and Dr. Bell Anyamali, thank you for those amazing presentations. I thought that was great. So we have about 10 minutes left and we'll go into our Q&A session. And my first question is for Senator Steiner Hayward. Working as a policymaker is a privilege and critical role in making legislative change, but so are the efforts of people who don't do that for a living. Can you share an example of a community member or leader who has played an important role in passing policy? And what advice would you give to the audience for making a difference? And it looks like you might be on mute, Senator.
I don't think I can unmute myself. Oh, there we go. Okay, am I unmuted now? Yes. I'm not allowed to unmute myself, so thank you for doing that. I want to call out the work of a woman named Martha Brooks. Martha has been a staunch advocate for home visiting programs in Oregon for 20 years or more, and has been able to demonstrate not just the school to prison pipeline, but the early childhood to prison pipeline, and how in order to ensure that every Oregonian has the opportunity to live a healthy, meaningful, productive life, we really need to be focused on the youngest Oregonians. And Martha's work has really been critical to this. And I've been privileged to learn from her for 10 years or more now. And I think the advice that I would give to people are, first and foremost, be willing to build strong coalitions with diverse people. Second, identify the people with the passion in your community. And third, don't be afraid to tell personal stories. I think it was really helpful when I was working on this, admittedly as a policymaker, to talk about my experiences of having young children, new babies. And I should have every advantage in the world. I was married. It was a planned pregnancy. I was a doctor. We owned our own home. Their father was a proven father, right? All those things. And all sorts of challenges with both of my newborns. So I think telling those personal stories can be really, really powerful.
Absolutely. Thanks, Senator Sen Hayward. Ms. Altoon or Dr. Bell Anyamali, would you like to jump in and give an example?
Sure, I'm happy to. Yeah, I mean, I can speak as a organizer, and at 9 to 5, we're a member-based organization. So honestly, countless examples. I do want to name the work of one of our longtime members, Chris Garcia. He is someone who has been impacted by the lack of paid family and medical leave multiple times in his life, unfortunately. And, throughout our fight and now into implementation, he's been sharing his story, showing up every step of the way. And I think, his experiences are a really great example of how, this work it doesn't require, any expertise or whatnot. Lived experience is an expertise. And so essential to building these policies. So yeah, I would encourage folks to share their stories and listen to stories.
Great. Thanks so much, Ms. Altoon. And let's go to the next question. And I will go back to you, Ms. Altoon. You are all champions of exceptional policies within your state and elsewhere. So what's next? What trends are you seeing in early childhood education legislation?
I'm happy to start unless Ms. Altoon would like to, or Dr. Bell Anyamali.
I can go ahead.
Yeah, please.
Okay. Yeah. So just speaking to what I'm hearing in my work with members, I would definitely say childcare comes up all the time. It is so expensive and such a huge burden on families. What I would also point out that may be a bit more unexpected is workplace policies. Parents, unpaid caregivers can face a lot of discrimination in the workplace with hiring and opportunities, as well as a lot of workers have shifts that are scheduled without consideration for their lives outside of work, which is their families a lot of the time. And when we don't have these types of protections, of course it harms that individual, that worker, but it also really hurts that whole family ecosystem. So I think, increased work in these areas and improving protections is really meaningful.
Yeah, that makes sense. And Sen Hayward, did you have a response here?
I just want to make sure that Dr. Bell Onyemale she looked like she wanted to say something as well, and I want to offer her the next opportunity.
Okay.
Thanks. Yeah, I was just second things that Caitlin said, but also adding, especially in Texas, around bilingual education for our both our children, and then also for teachers and caregivers as well. How are we prioritizing those students? Also seeing things around more support for children with developmental disabilities and delays and things like that, and how those sort of things can intersect for families and children.
And I think the only thing I would add, in addition to agreeing with everything that my colleagues have said, is the idea that we need to separate out services to families and to very young children from the traditional K-12 education construct. New Mexico passed legislation separating out their services in early childhood several years ago. Oregon, we passed that in 2019 to create a whole new department of early learning and childcare. And the idea is to pull the childcare stuff over from our Department of Human Services and the early learning stuff over from our Department of Education and put them in one place. Because really, these two pieces are a continuum, and we need to understand them as such. We need to ensure that childcare is, as Ms. Altoon mentioned, affordable and developmentally appropriate, and that's what tees children up for success all the way down the road. It doesn't mean starting to drill 2-year-olds in their letters. It means offering them the opportunities for developmentally appropriate settings, and that's very important as well.
Well said. And Dr. Bell Onyemale, I want to start with you on this next question. And to get us ready for our next panel, it's on restructuring the government to meet the needs of families and young children. So how would you change governmental systems and structures to better meet the needs of children and families?
I think we've talked about this. I think maybe Caitlin talked about this before, but just this recognition of what we have is not really working, right? Like, we don't recognize that mothers or parents and things and that nature, the system that we're within is not working for them, right? And so there's no FMLA, like there's no family medical leave. So that is a barrier from the very beginning, right? And then there are these things that happen along the way of just even general policies around leave in general for people to be able to take care of their families. So I think there's just as a major restructuring in general of how we think about work. What does that mean in the life, and what that means for how we want to support families and children.
Absolutely. And Ms. Altoon, did you want to jump in and take that question next?
Happy to. Yeah, what I would love to see is, I mean, as I mentioned, privatization was a huge fight in Colorado, and we continue to see this just as a trend throughout the country with public services. And I would like to see a move away from this because our communities, really need that transparency and accountability to effectively deliver on these policies and programs that are so essential. And, I would like to see just deeper co-governance between our lawmakers and communities and having those relationships and accountability enriched.
Absolutely. And Sen Hayward, we have about a minute left. So why don't you take us home and then I'll close this out.
Thank you. And it's been a privilege to learn from my colleagues today. In addition to what they've said, I would add that it's very important that we have a requirement that all of our community partners give us data on their outcomes, because we want to ensure that every child, every family has opportunities to get the best quality services, the best quality childcare, the best quality early learning environments opportunities possible. We want those to be community driven, as Ms. Altoon said. It doesn't mean that it has to be all offered by our school districts. It does mean that we need to hold each other accountable. Oregon is fortunate that we have what's called the Oregon Child Integrated Data Set, where we collect data on every child born in Oregon over the birth to 18. But it takes a while to get there. So we need to be thinking about data systems and how do we have better real-time data Conversely, though, I think we need to say if we're implementing an evidence-based program with fidelity, we should not have to prove that we're saving money, because a lot of times these programs take time to see the best impact. And so we have to have a certain amount of take it on faith while still collecting data on the actual outcomes, if not the economic impact necessarily.
Well said. And thank you, Senator Steiner Hayward, Ms. Altoon, and Dr. Bell Anyamali for such a terrific session. And many thanks to all of you who joined us and stayed a little bit late. Next up, we have a short networking break, followed by our panel on restructuring government and programs to meet the needs of families with young children. And that session will begin at 4 p.m. Eastern. And if you've not tried the conference networking function and would like to make some new connections, select the networking icon on the right in the reception area, and you will be paired with another conference participant for a quick get-to-know-you chat. Thanks again, and we'll see you back here at 4 for our next session.